Today we will be talking about the LGBTQ plus experience in healthcare. We are joined by a special guest, Dr. Barbara Hurst, who will quickly introduce herself.
My name is Barbara Hurst. I am a board certified OBGYN and I practice gynecology only in Salt Lake City. I have practiced for the last 33 years in this capacity.
What disparities have you seen in your scope of practice that LGBTQ plus people face in healthcare?
I think oftentimes this population is uninsured or underinsured, and that just makes it very difficult for them to access adequate health care. I think they're often also not treated well or not understood well and might wait until a problem is more advanced before they seek help.
Could you share an example of obstacles that LGBTQ plus individuals face and how you as a provider can help alleviate those barriers?
Yeah, I can think of a patient that I saw initially a couple of years ago, and this patient was in the process of receiving hormone therapy and psychotherapy in anticipation of transitioning from female to male. And the next time I saw the patient, it was more an issue of not necessarily completing transition, which I didn't realize was relatively common, but identifying more as non-binary and needing guidance about options for contraception or birth control and how to manage menstrual periods. And this patient asked to be known as a name different than the name assigned at birth. And so that was really important to me to remember that and make sure that everyone on my staff knew that the chart was flagged that way so that we didn't call them the wrong name. And also, this patient used they, them pronouns, which honestly is hard for me. I'm a really grammatically correct person, and so to use a non-singular pronoun for a singular person has been a real adjustment for me. And I have asked the patient and apologized to them when I used the wrong pronoun because it is so automatic for me. So I think that just educational process for me, for my staff, this patient ended up having some surgery, and I tried to make sure that the staff at the hospital also knew what name to use and what pronouns to use. And I think that really made their experience better and easier, because that can be really intimidating for any patient, but I think especially for someone in this population.
How did your actions and that of your staff impact the patient?
Hope that it made them feel much more comfortable about any encounter in healthcare, but certainly the encounters in my office and at the hospital where they had surgery, that we were really sensitive to the issues and trying our best to treat this person with respect and with, again, the identity that they wanted.
Thank you to Dr. Hurst for sharing knowledge and perspective on such an important topic. As future healthcare providers, there is so much to learn from these discussions. I hope we all take something from the experiences shared with us.